All right, welcome into 5 on Fridays. Really excited for this episode today. We are talking skin health, everything you need to know for the summer, and making sure that you're protecting yourself and your family the right way. I want to bring in Megan Alt. Megan, how are you doing?
Hi, Brandon. I'm doing great. Thanks for asking.
Absolutely, and we're really grateful and appreciative that you're here to talk to us today about skin health. I want to dive right in. Can you tell us a little bit about sun exposure and the dangers that it poses to our skin, especially as we lead into these warmer months and get ready for the summer?
Yes, absolutely. So we worry about two UVA and UVB rays. UVA rays cause sunburns on our skin. And then the UVB rays are a little bit longer and they can actually cause damage to on a deeper level. So both can cause premature aging, it can cause wrinkles, and unfortunately, it can cause skin cancer. And skin cancer is actually the most common form of cancer in the United States. And it's actually one of the very few cancers we can actually see because most of the time, cancer it forms on the inside of our bodies.
Yeah, and so you would think that it would be easier to detect and something that we are more acutely aware of because it's on the outside of our bodies, but I feel like it also gets underreported and isn't talked about as often. So tell us a little bit more about skin cancer, some of the terms we should be aware of and what we should look out for.
So we kind of categorize skin cancer into two areas, a non-melanoma, which includes basal cell and squamous cell, and then also melanoma. The non-melanoma is less invasive, less aggressive, and higher cure rates, where the melanoma is much more invasive and it's the most deadly form of skin cancer. And there is a genetic link to it. So it seems to run in families. Oftentimes skin cancer forms on the sun exposed areas of our skin, top of our ears, our neck, our hands, but it can occur anywhere. And especially the melanoma, it can occur on the bottom of our feet, inside our mouths, in our eyes, and our nails. So we just need to be aware of that.
Yeah, I didn't actually even realize the different parts. I mean, it makes sense. Your skin is all throughout, but I usually have just always associated it with I've been out in the sun too long on parts of my body that have been exposed. I never thought about the inside of your mouth or the bottom of your feet or the genetic part that you talked about. So if that's the case, how do we protect ourselves?
Sure. Seek the shade. I mean, it seems very easy, but seek the shade, especially when those rays are at their most intense. And this is between 10 a.m. and 4 p.m. And you also want to make sure you have extra protection if you're at a higher altitude. So if you're traveling at a higher altitude, the atmosphere is thinner. But you also, if you're going to be working, playing around water, sand, snow, ice, those all reflect and can cause an increase in 80% of those rays. You also want to make sure you avoid tanning beds. Tanning beds are worse than the sun, really. So, and a tan is actually damage to our skin. It's a way our body is, an imperfect way our body is trying to repair itself. And you also, one of the best ways is to cover up with clothing. So you can find SPF embedded clothing. You can also use umbrellas. You can use a wide brimmed hat, use SPF blocking sunglasses. Not all sunglasses are created equal. So make sure you find one that has the SPF or the UV blocking in the sunglasses as well. And one of the most important things we can do is to check our skin. The recommendation is for once a month, every month, the first of the month, look over your skin, get a mirror, take a look at your back, take a look at your feet. Try to have somebody kind of take a look at your scalp, especially keeping an eye on any worrisome spots that you have. Along with that, you can go and see your dermatologist once a year as well.
That's so interesting. And you spit out a term that I'm sure most of us watching this are familiar with, but if we can, I want to dive into it a little bit more. SPF, sun protection factor. Am I right?
Yes. Yes.
Okay.
Yes.
So SPF, we know it's in sunscreen. You mentioned it's in clothes. Can you walk us through a little bit more about that? And then maybe what you would recommend in terms of what is the best sunscreen? I think there's a lot of debate about what that means.
Yeah, absolutely. So the SPF protects us against the UVB rays, but you also want to look for a broad spectrum when you're picking out your sunscreen, because the broad spectrum is going to protect you against the UVA rays. So those are the longer rays. And then also you can look for the skin cancer foundation seal of approval. This will be on sunscreen. This will be on clothing, hats, whatever gets their seal of approval for good skin protection. You can also look into getting waterproof sunscreen. You can get sensitive skin sunscreen, and you want to make sure you're reapplying your sunscreen every 2 hours, or after you're done swimming or after you're done exercising, if you've sweated off, that sort of thing as well. And then just note No sunscreen protects you 100%, unfortunately. So just make sure you're covering up as best you can with that clothing.
Those are great tips. That makes a lot of sense. And I know you kind of touched on it a little bit. I know from a different episode of 5 on Fridays that we did, and the idea that you can actually still burn in the winter. So my next question is about cloudy days. We may think, oh, we don't need sunscreen, we're fine, the sun is not out today, but that's not true, correct?
That's not true, unfortunately. You still get about 80% that exposure come through the clouds. So you still get quite a bit of that,
Wow.
that sun exposure. You can actually get exposure through windows. So if you're on a long car ride, or if you're in an office that has a nice, beautiful window, if you're blessed in that manner, but you can still get sun damage to windows, just to be aware and alert of that.
That's a great tip, and something, like I said, that I don't think any of us are aware of. So we've been out in the sun, whether it's sunny or cloudy, and I did not do the things that Megan told us to do. I got a sunburn. What's next? What do I do?
Yeah, so once you feel your skin getting hot, red, tingly, you want to get out of the sun and start treatment. You want to be drinking fluids while you're in the sun, and then days following. So it's days following to just repair your skin. If it's a mild burn, you can take a cool bath, you can apply a cool compress, you can apply some aloe vera. I have an aloe vera plant in my house. I just snip off a piece and I rub it on, any area that's burnt. You can take over-the-counter pain relievers if you need to for those mild burns. With any super severe burns, you do want to get it checked out by your primary care provider or a healthcare professional as well.
Awesome. Lovely tips. And I know we touched on the monthly exam. If I get into a really good routine of checking myself, or maybe I have, a friend or a family member keep an eye on me throughout time, what are something that we are looking for that we can educate others to look out for on themselves? What exactly are we looking out for?
So think of the alphabet. This is especially helpful when detecting the deadly melanoma that we talked about. So think A, B, C, D, E when you're taking a look at your body. Okay. So A is for asymmetry. You're taking a look at the shape. We don't like an abnormal shape. B is border. So we're taking a look at the edges of the mole. Is it irregular or is it nice and smooth, that's what we want. C is color. We like one color. Is there varying shades of brown, black, tan, or there also can be in melanoma, you can find red, white, and blue in the later stages of melanoma. D is for diameter. That is the size of the mole. So anything super large we are concerned about. And this is about the eraser tip on a pencil. So anything larger than that. E is evolving. Is the mole changing? Has it developed crusts? Is it starting to bleed? Those are all worrisome signs. So if you do figure out, if you see something that's worrisome, just get it checked out, have your healthcare provider keep an eye on that.
Yeah, wow. And I know that you sent over a wonderful graphic that we were showing throughout this little section, and we can use that as a really clean guide, but I'm sure we could find those online too if we needed an additional reference, right?
Yes, absolutely. Skincancer.org. You could just Google, ABCDEs of skin cancer protection, and it'll come up. A lot of helpful pictures and guidance in that manner.
Awesome. That is really, really helpful. As we kind of wrap up here, Megan, is there anything else that we should be aware of as we turn to the summer and think about our skin health?
Yeah. So definitely most of our sun exposure actually occurs during the brief times we're outside all throughout the year. They add up. So this is when you're taking a brief walk with your dog, checking the mail, running errands, on your commute, walking to and fro. So just remember to keep kind of your wide brimmed hat beside you, wear your sunglasses, keep yourself protected during those brief times that you're outside. But I definitely encourage everyone to get outside. It's incredibly healthy for us to get fresh air, good for our physical and mental health. But when you do so, just make sure you protect your skin.
That's awesome. Megan, thank you so much for your time today. We really appreciate your expertise and your 2 cents on all of this. Make sure you're taking care of yourselves this summer. Until next time, hopefully we can have you back and we can talk maybe before the winter so we can kind of make sure we're protected through the fall and the cold weather months as well.
Yeah, sounds great, Brandon. Thanks for having me.
Thanks, Megan.